Dr. Quinn, thank you for being with us today.
Hey, thank you for having me.
I know you say it just won't go away. How contagious is this new subvariant?
Well, that's the problem with this new subvariant. The researchers, the reports, it's being very well documented that it's much more contagious. This means if you're around someone that has this new BA5 subvariant, there's a much higher probability that you will contract coronavirus, this new subvariant. But also something that's being watched is the fact that it's also much more able to evade previous infections. In the past, if someone had an infection with coronavirus, their antibodies would raise and they would be relatively safe, especially if they've been vaccinated. But with this new subvariant, it's able to evade this protection, which makes it much more dangerous. That's why so many medical personnel around the country, around the world are very concerned.
Dr. Quinn, is there a lot of concern that the hospitalizations are going to be going up?
Well, I mean, the bottom line is the hospitalization, but the infection rates are going up very significantly. But if you remember early on in the pandemic, usually the hospital rates, the deaths, all of this comes later, because what happens is as more and more people get infected, there's a higher probability of our vulnerable population getting infected. And these are individuals that are elderly and with chronic medical conditions with compromised immune systems. That's why the FDA, the CDC, and all the other organizations are really watching closely. And we're just urging people to understand that we're not saying you have to wear a mask yet, but just know if you have high probability of getting sick, if you're vulnerable with those chronic medical conditions and elderly, you may consider wearing that mask again.
One last question, Dr. Quinn. How effective are the vaccines against this BA5?
Well, the vaccines are still effective, but they're not as effective as with the other subvariants. And what's being documented is the fact that if you've been vaccinated, if you do contract coronavirus, after you've been vaccinated with that breakthrough infection, which can happen, overwhelmingly individuals that end up in the hospital, in the ICU, and or losing their life are not people that have been vaccinated. So the vaccinations can't fully protect you from contracting coronavirus, but if you do contract it, you have a much better course overwhelmingly if you've had your vaccinations and your boosters if you're eligible.
Wow. Dr. Timothy Quinn, Quinn Healthcare up in Ridgeland, thank you very much for taking a little time out of your Friday afternoon and enlightening us to this, thank you very much, brand new virus or subvariant that we have. I just have to keep up with everything now. Thank you, Dr. Quinn.